right, let's make sense now of the COVID-19 statistics over recent days. South Africa officially entering the fourth wave. Reports that we are 3 times more likely to get infected this time around due to the new Omicron variant. But the good news is that seemingly mostly mild cases amongst the vaccinated. We're hearing that from doctors in private healthcare and in government, given what they've seen thus far. To discuss, we're joined by senior researcher at the CSIR, Ridhwaan Suliman. And Dr. Suliman, thank you for joining us as always, and you give us these great graphical representations of where we are. So let's start with the 7-day sort of moving average that is the main indicator of where we are, and we'll bring that up.
Good evening, Francis. Thanks again for having me. So if we look at the number of cases reported nationally, it still remains a leading indicator of the COVID-19 trajectory in the country. We are reporting an average of just over 5,000 new cases per day over the past week. And while that number is still relatively lower than what we have seen at the peak of the previous wave, we're up to about 25% of what we saw at the previous wave. What is of concern is the rate of increase, where the current new cases have increased 5-fold compared to a week ago.
All right, Dr. Suliman, we've lost you completely. While we try to get him back on the line, let's keep that graph on screen, because what it shows you is the first wave, then the second wave, then the third wave. So we can see the cases going up and getting more intense each time. And now we're seeing the blip on the screen. On the right of your screen is the fourth wave. And it's not as full as the other waves, because we've just entered that fourth wave. But what it does clearly show is that there is a very dramatic upward trend from very low cases to that spike. So, Doctor, you're back with us. Just continue where you left off. Sorry, we got cut off there.
Thanks, Francis. Apologies for the break in the network. So there still seems to be an echo in the background. I'm not sure if you can hear me clearly.
We can hear you. It's great now. Carry on.
Thanks so much, Francis. So as I was indicating, we certainly are well within the fourth wave across the country now. And while the absolute numbers are currently about 25% of what we saw at the peak of the previous wave, it's that rate of increase that's most concerning. The number of cases, the 7-day average, has increased by about 390% compared to a week ago, or almost 5-fold increase in that number, or doubling about every 3 days. So that is the concern right now. And there possibly is an argument that case numbers are not as important now, but I think it probably is still relevant to indicate that the cases still are leading indicator, giving an indication of what we could possibly expect in terms of hospital numbers, and we can look at that in a second. But beyond that also, if we're dealing with a largely more transmissible variant, there may be many more people that get infected, which in absolute numbers could result in many more people requiring hospitalization. And of course, possibly, we don't know yet, but many people struggling with long COVID symptoms too. So case numbers still remain a concern, and the rate that we're seeing now is certainly not looking good.
Yeah, an incredible surge, and then we will look at the hospitalizations, we'll look at the death rate as well. But let's start with that test positivity rate, which is so important because it shows just the general prevalence, and an incredible surge there as well. That's the next graph.
Yes, absolutely. So we know that because of our testing strategy, we do need to take into account the amount of tests that we do, and take that into consideration when looking at the number of confirmed cases. But of course, concerningly, the test positivity rate is also increasing quite sharply. Daily positivity rates yesterday and recently in excess of 20%. At the moment, the 7-day average of that test positivity rate nationally is above 12% currently. But of concern is also that rate of increase. A week ago, that test positivity rate was just under 3.5%. So it's increased by almost 4 times at the moment to above 12% as a 7-day average currently.
And you can see that much steeper line when it comes to the fourth wave. Let's move to the next graph, which focuses on Gauteng specifically. And Gauteng, tell me if I'm wrong, Doctor, but basically the epicenter of Omicron for the world right now. And you've overlaid wave 1, 2, 3, and then the fourth wave in black, where we see this sharp increase starting. Just run us through this.
Indeed, Francis, Gauteng is the epicenter of the fourth wave in the country, and all eyes are on the province right now. In terms of the rate of increase of the Omicron-driven fourth wave right now, as you can see by the black line, it's increasing much more sharply than what we saw at any point in the previous waves. So Gauteng's numbers are currently driving what we see nationally. The province is reporting an average of just under 4,000 new cases per day over the past week. But of most concern is that rate of increase, almost a 400% increase week on week, or in other words, a doubling time of about every 3 days. And you can see that reflected in that steep gradient, an exponential rise in the Omicron wave in the black line right now.
Sure, so doubling, the numbers doubling basically every 3 days. And staying with that graph, Doctor, does it confirm the opinions that Gauteng could actually reach the peak of the fourth wave pretty soon, maybe in the next few weeks?
Yes, if we just look at the rate of increase right now, I mean, we could possibly even reach a peak within the next 2 weeks. It really is difficult to say at this point. There still is much unknown. What is looking quite likely is we'll probably exceed the numbers that we even saw in the previous Delta-driven wave, that blue curve that we just experienced over the winter months. So unfortunately, case numbers are really rising quite sharply, and the numbers that we may see may at this rate exceed previous levels that we saw at any point in the pandemic.
All right, so we could see a much higher peak. And let's stay with Gauteng, because that has been where it's all started. And look at the test positivity rate for us, if you don't mind, specifically in Gauteng.
Yes. Exactly. So as indicated previously at a national level, it's always important to also look at the test positivity rate when looking at the number of cases, confirmed cases. But if you see towards the right of this graph, the test positivity rate in Gauteng is also increasing incredibly sharply. The latest data towards the end of the previous week indicated a test positivity rate of almost 16% compared to just under 4% the week before. So a considerable rate of increase, and no doubt that has even increased much further this week. So really confirming that increase that we're seeing in the number of confirmed cases is real, and there certainly is many more undetected cases. So had we been able to test more, we may even see a larger number of confirmed cases than what we're even seeing now.
All right, quickly, just to set up your final two graphs, we are hearing that at least amongst the vaccinated, the cases seem to be mild, and we're not seeing that heavy pressure on hospitals, and we're not seeing an incredible surge in deaths. Let's quickly look at hospitalizations in Gauteng. Tell us what these numbers are saying.
Yes, so as hinted at earlier, I think case numbers may not be as important now. We're hoping to see a weakening or decoupling of the link between cases and hospitalizations, and then ultimately the number of deaths. So all eyes are currently looking at the number of hospital admissions in Gauteng, since we saw the earliest rise in cases in the province. The last week saw an increase of over 170% in new hospital admissions compared to the week before. So an incredibly sharp increase to a doubling time of about 6 days. So that while that is slower than the rate of increase in cases, remember that was doubling about every 3 days, it still is a very sharp rise. So I think it's probably still early days to read too much into the data right now. Remember that there is a lag in the between cases and hospitalizations, as well as a lag in the reporting. But at this stage, the indication is that there is a slight decoupling, and while hospitalizations are still increasing sharply, it's not as sharp a rise at what we're seeing in the number of confirmed cases.
Yeah, that is a hope, the decoupling. Thank you very much, Doctor. I hope to chat to you soon as we get a more full picture of what's going to